Hello, everyone, and welcome to the Becker's Health IT and Digital Health Leadership Spotlight. Today, I'm really excited to be joined by Tim Skeen, who is the Senior Vice President and, sorry, I'm going to get that right, Executive Vice President. My apologies. Let me try that again. Sorry. 3, 2, 1. Hello, everyone. This is Laura Deirdre with Becker's Healthcare. I'm really excited to have today with me on the Becker's Health IT and Digital Health Spotlight, Tim Skeen, who is the Executive Vice President and Chief Information Officer at Sentara Health. Tim, it's a pleasure to have you today on our video series.
Thanks for having me. I appreciate it.
Absolutely. Well, we're excited to have you here, and I know you'll be speaking at our Health IT, Digital Health, and Revenue Cycle event in October, so we'll definitely continue the conversation there. But for today, I was wondering if you could tell us a little bit about a project or initiative that you found really successful in the last year at Sentara Health. I know you've done a lot on artificial intelligence, Gen AI, and some of the cool ways that can really support your mission at Sentara. So I was wondering if you could talk a little bit about that and just tell us what you did and what were the results.
Yeah, no, absolutely. Happy to. And none of that gets started without starting way back when in the original origin story of setting up kind of a governance and a focus around how we were going to think about leveraging AI, especially in the clinical space. And so that started about 3 years ago with establishing an AI steering organization and governance group underneath our data governance committee that would focus on the ethics, bias, and the use cases around how we were going to leverage AI and especially Gen AI in that space. And at the same time, we'd been talking with a company that was focused on AI in the acute space as it would do assistive work with hospitalists. So we started that pilot. So like I said, almost 3 years ago, we're starting to roll that out across our facilities. And the concept is that a hospitalist would have this engine that would look through the entire EMR record, look at all the history of their data, and come up with what things, possible conditions should I worry about? What data am I coming during that episode of being in the hospital that day-to-day I should fear about documenting and driving that through the process. And so it kind of guided them and assisted in that. They could click on things they agree on with, things they don't agree with. And the beauty of that, it gave them more time to spend with the patient in their rounding as opposed to documenting and focusing on the EMR themselves, as well as having that patient interaction. And then the bigger benefit of that, after we had done this and started training the LLM, the large language model engine that we were going to use for discharge summary, at the end of that episode, it would take all the historical data, it would take all the data that was gained during that stay in the hospital, and would put a very specific targeted discharge summary to leverage the post-acute care with the providers that were going to continue that person's care once they were discharged. And it was an interesting journey, not just to get adoption and for people to figure out how to work with this assistance and to trust it and to challenge it and how to make that help their job be more effective. But then also working with some of the hallucinations that would happen early days with that discharge summary that we had to then train and guide to get it the way that the patient and the provider was going to support their care afterwards. So found that to be very beneficial in terms of improving quality, safety, financial benefit in terms of being able to fully build the work that was done more comprehensively. And it's been something we've rolled across all of our 12 acute facilities. And now we're looking about expanding it into other modalities and other sites of service.
Well, that's amazing to hear. And I know a huge undertaking from the system perspective. So anything you learned while you were deploying that across the main inpatient hospital campuses, and really that would be especially beneficial for those organizations that are just starting to look at how they can apply AI, generative AI, in trying to get their hands around this governance process?
Yeah, I think a good thing to think about is that this isn't about the technology, and it's not about how selling them on how cool the technology is. It's about getting the right champions within the use case to say, how is this going to make your job better? And so luckily, my chief medical informatics officer, Joe Evans, was the one that was championing this and being that voice, as opposed to the CIO voice to the clinicians in the hospital is not going to be listened to, right? But the CMIO, they'll listen to because he's a physician as well. And so he took that out into the space and started talking about what it could do in terms of their workday, their workflow processes. And then he established champions at these different facilities. And so for one, it was very important to pick the right first facility with the right president that had the right adoption focus in terms of pushing that, with the right champions that were open to different ways of work and reimagining that, because the engagement, changing of your work process, and then fullest adoption is only how you're going to get there. Now, the intuitiveness of the technology was a benefit, but getting that champion across those two facilities and then doing that one at a time to make sure we had those champions was really important. And I'm happy to say that we're well over 75+% adoption with this technology. And I'll tell you, with a lot of historical experience I've had, you get 25% adoption with clinicians, you're happy. So this was really engaged to them. So it was helping them with burnout, it was helping with guiding. They saw the benefit of it. They were getting more time with their patients. So there was that additional incentive, and the champions that sold them on how great it was, because then all that gets the momentum going and builds on each other. So that was a great lesson learned about how to also take that and think about when we're rolling out other pieces of AI and ambient AI that we've done since.
Got it. No, that's really helpful. It definitely makes a lot of sense, in terms of looking beyond the technology, just understanding the change management that occurs when you bring in this type of tools, and especially with AI. I know it has all sorts of connotations to people. So, looking at having such a powerful person that can really drive results on the advocate side, but then too having those results for how it can alleviate some of that burnout and the other areas where it really truly the clinicians found it as a benefit is such a great story to tell. I'm curious, especially looking at the investment that it takes to bring in new technology. How do you think about the results and just making sure that you're getting the return that was promised to you? When going through those negotiations and understanding from the vendor side, what they're saying you'd get.
Yeah. So, boy, there's a lot to unpack on that. So what I will do is talk about some of the things we've done with our CEO that took over just over 3 years ago, Dennis Mathis. We kicked off a multi-year transformation process called One Sentara. And so in that One Sentara framework, it's not just One Sentara about how to be one view across our health plan and our care delivery to the patient, member, consumer out there, but also how are we going to, as One Sentara across all those different lines of business, make decisions about what solutions we should do and how we measure them and how do we prioritize that portfolio. I think historically it was about, okay, which person screamed the loudest would get the capital funding, right? As opposed to having a good business case and an ROI, much less measuring whether the ROI they sold on the business case actually came to fruition. So within that framework, within One Sentara, we created a whole process and governance and a tool set that basically has the entire portfolio captured in it. And part of the L gates, there's L0, which is the ideation gate, all the way to L3, which is implementation, and L5, which is final realization. Those gates measure how we decide if somebody's going to be executed from L0 to L1 to L2, and then actually funded going into L3. And so that process is now much more rigorous in terms of building up the business case. Finance is a partner with all those work streams and the sponsors of those work streams to sign off on the business case. And then finance, then from that point on, that tool will get the results, and finance will measure, not just the first year, but the next 5 years. Are we getting that result on a continuous run rate basis in terms of benefits? So, that framework was a good framework to have in place that's our broader portfolio, but just using that to inject these types of tools into it, because a lot of people, especially in these early days of Gen AI, and AI is a spectrum, so I'll focus on Gen AI because AI has been around for 30 years, but especially in some of the more advanced AI, predictive models and Gen AI, there's a lot of soft, right? There's a lot of cost avoidance and there's a lot of soft benefits. And so trying to find the one that has that combination of hard and soft benefits is really important, because that measurement has to be more than just, reducing clinician burnout as an example. That's important without a doubt. And there's benefit to that, but that would be more of a soft environment. Something that's basically saying, hey, we're getting more robust and comprehensive billing of the whole episode of what all the care we did, and we're collecting more of that revenue because we now have this tool to get the documentation and support more effective in the system. That's a hard thing that you can measure and get that ROI back on. So that discipline of doing that has helped in terms of being able to guide what things we work on and then how to measure those successes. And I'll say it also opened up the concept of fail fast, because some of these ideas that we're trying to push hard on, moving quickly on, they're not all going to meet. You have a belief that it's going to solve this ROI, but if it doesn't, you pivot, you shut it down, and you go say, well, let's get those resources and let's go grab the next up thing that has the biggest ROI that we want to bring in, that brings value to our business as well as to the consumer.
Absolutely. That is such a helpful context in terms of how you think about, making decisions, and really seems like it's an efficient way to get everyone together on the same page. Now, as you look into the future, the next 12 months or so, how are you building on these successes? What do you see Sentara doing and continuing to iterate on, as you talked about, continuing to bring on the technology and figuring out what makes the most sense for you?
Well, I think we're just going to continue on that discipline and rigor that we've established on and improve upon the execution and delivery on all those initiatives, right? When we first did this bottoms-up plan of the One Sentara transformation, we had probably over 1,000 initiatives. So that is a lot of moving parts. You could only deploy so much, not just even with injection of unlimited capital and resources. There's so much change that an organization can take on, in the different lines of business. So we're continuing to understand what that breaking point is, and we're continuing to ideate. And so actually we're going to be kicking into another full 3 years bottom-up plan strategy to do another block of this time for the next 3 years for that strategy. And so that is a big part of what we're looking to do in that environment. At the same time, I'd say we're trying to build on a couple other things related to the success so far that we've had with AI and Gen AI. One is a multi-year acceleration and enhancement around our data and analytics roadmap. So everything to make AI and Gen AI successful, you have to have a well-curated, high-quality data repository and analytics framework to be able to rely on that data to build out these models. So that's a big piece of what we're doing. We're also driving to care delivery redesign and the interaction of how the consumer is going to interact with self-service, getting to the right service, the right type of provider service in the right setting, meeting them where they are, whether that's in a facility, in office, at home, in our urgent care, wherever that virtual component is. And then I think the next piece that we started rolling out just at the end of last year, and we're about to finish that within all of our acute facilities, but then we're going to expand it, is the leveraging of a virtual care platform. So let's understand that we're going to have to reimagine, not just because of access issues, but clinical capacity issues, model of clinicians across the spectrum. How are you going to cover and have enough clinicians to provide all the services we need to do? We've got to be able to leverage a ubiquitous ecosystem that can bring technology and the clinicians and the data in contact in the site of service, in the space that the consumer wants to get the care they need. And so we've rolled out virtual nursing across those platforms. And what we're going to then now roll out further is expand our telesitting, expand our EICU, which has been a bunker model, but get that to a distributed model and a federated model from nursing all over the country to support that need from a capacity standpoint. Adding virtual rounding, virtual consulting, right? Turning on what we're turning on around observational AI. So use that framework for virtual nursing with the camera and that video to now turn on observational AI, where we can now look at, are rooms clean or not clean? Are we doing proper hygiene? The fall risk, we can actually understand, is the patient with fall risk going to get out? Can we immediately notify them through that virtual interaction, either with a chatbot avatar or with an actual virtual nurse, to get somebody physically in there and make sure we get them out of bed without incident or injury, right? So there's a number of quality measures that we're going to be able to do within that. And that observational AI is getting smart enough based on colors and types of clothing that we can say, oh, well, that's the patient. The patient's doing this. Here's a nurse that's doing this. Here's a caregiver that's doing this. Here's a physician that's doing this. And now we can understand, what kind of interaction are we having? Is it the right interaction at the right time? And we can start doing that update around quality and such that continues to ramp up our high quality already that we see scored on Leapfrog across our facilities and other things we do. This is just another add piece on. And once you have that infrastructure in place, I think you're going to see those use cases continue across to how you change the organizational and clinical care delivery model, but then all of the different algorithms and the AI models that are going to keep on being developed and built and refined, as well as, of course, the video, the ambient interaction that whole framework can do. All those things are getting much more sophisticated. So I think you're going to see a lot of churn in terms of figuring out what are all the different things that work. Then the dust will settle on those ones that really productionalize, and we'll keep on inventing that. And so very excited about what instrumenting our entire healthcare ecosystem can mean to the benefit of our consumers, patient members, as well as our clinicians, and how they interact and how their model is working. And then how we tie that across both the financing of health plans and health insurance, along with reimbursement and what we do from a care delivery standpoint to keep all of our care facilities, open and operating.
Oh, that's amazing to hear, and really cool to understand what the technology can bring to the table and how it can help transform the care delivery models. And especially, as you said at the end there, bringing it into the health plan and reimbursement and everything else that just makes healthcare such a complex environment to be in, but also obviously a very powerful one and one that's so needed to care for the communities. Now, when you look at all of those things and think about your IT and technological teams, do you see them evolving at all? What do you see as being some of the changes that could occur as you continue to implement this vision of the future?
Yeah. So it's a great question, because just as the end users have to adapt to how to use this assistive technology in their environment, we have to have our talent thinking differently as well. One of the core foundations, and something we started over 5 years ago and have rolled out, is getting to a pure cloud environment for our infrastructure. And that's really important when you're talking about the ubiquitous flow of data and interoperability in the ecosystem. So that's a good foundation to have in place. We did a whole upskilling component to our teams to understand how to operate and support cloud. And we'll say some of the technologies that are cloud native out there. So, and then moving our core systems like Epic and others into that cloud environment, so they're all accessible, right, from an egress standpoint to those rest of those ecosystems. So that's one component of foundation training we started way back when. 3 years ago, when I talked about starting the AI governance, we started immediately with literacy, both data and AI literacy. So we presented to the CEOC, we presented to our board, and we continue to present to our board on twice a year basis at board meetings for that literacy. What we've also rolled out then just 3 or 4 months ago was a full self-service data literacy and AI literacy component, so that people can understand, what does AI mean? What is the different types of AI? What is Gen AI unique to? What are the kinds of use cases in our space that you can think about, right? Because the problem with all of our users out there, a lot of them are very open to this technology. Unfortunately, vendors won't come to just IT to be vetted, right? They go directly to the source, and that confuses a lot of things, because there's not a single vendor out there that doesn't say they're AI first, and they have AI enablement in their technology, no matter what it is. But once again, the definition of what they mean by AI is very different from what in many cases has started this, this latest innovation that is occurring with Gen AI, NLP, ambient listening, those kinds of things. So it's getting that basic literacy so everybody understands the terminology and the vocabulary when you're talking about it, so you can have that discussion. So when they come to it and say, hey, Tim, we want this vendor XYZ because they say they've got this great AI silver bullet that's going to solve world hunger. And so it's saying, okay, what do they describe that as? So they already know a little bit about what to expect and what questions to ask. And then we get involved as a partnership and go together to have those discussions about what that vendor may be able to offer. And I tell you, every time, the first thing I say is, I don't want to have a meeting with the vendor. First thing I want to say is, tell me your operational model. Show me my workflow process. Show me what is the outcome you're trying to achieve with this kind of tool? And are you going to have to do business process reengineering of your workflows and your processes and your ratios of clinicians to utilize this tool? So let's get the definition of what is the outcome, the KPIs, the OKRs that you think you want to achieve. Then we'll talk about the landscape of vendors that will help with that piece, fitting into the overall platform and IT ecosystem that we have today. So then we go through the exhaustive process of saying, do we already have these solutions in some of our platforms already? Do we need to rationalize them, or do we need to go find a new solution and find the right thing to bring that together? So it's important to understand what the problem is you're trying to solve, as opposed to looking for technology, looking for a problem, and them getting excited about that out of the gate first. So I think that education and that joint partnership that we're doing this together, we're not going to force tech down your throat, but we're also not going to let you go buy tech without going through this process.
That makes a lot of sense. And, it's just such a smart way to go about it, especially to make sure that, like you said, the end user, the clinicians, whoever might be being approached by the companies in new platforms can really speak the same language with you and understand, how the technology not only could reap the benefits that they're hearing about, but also just change, kind of some of their workflows and those types of things. With our last minute here, I was wondering just one more question. What do you see as being possible 3 to 5 years from now that isn't possible today in healthcare because of technology?
Yeah, so I'll talk about because of technology. That's probably not the right. That's not the right limiter. So I would say I'll go in reverse order. What I see the core limiters to getting us where we need to be. I think 3 to 5 years from now, there probably are no limit to what the possibilities are, right? If you think about the tools we have out there, how fast they're developing, and how smart they're getting in terms of that development, I think it's just what can we imagine is, from a technology standpoint, is how are you going to link them together? So how are you going to daisy chain them together, make them interoperable? Obviously, they have to be secure is a core piece of that. They have to be secure in how they're interacting in all those ways. But I think that is the least of our problems. I'd say the two bigger problems that are going to limit whatever that looks like in 3 years. The only thing that will limit it to being everything you can imagine to the future of what it could look like in terms of autonomous robots for care and other things being able to instrument, at home, various things to take care of all sorts of chronic conditions and other things in a much more effective way with a much smaller footprint of clinicians really working more efficiently. First is going to be regulatory environment. So I think right now, and I'll call it federal and state regulations around this. I'll add to that the perception of the regulatory environment. So I'll throw out there from our general counsel and our legal folks that have a perception that even taking that regulation and making it even broader in terms of limitations, they even go more conservative on that. So I think that is one of the biggest governors on it. Then the next piece of this, I think, is the governor that will happen by how quickly people can adopt and get comfortable with that technology in their care environment. And I'll put that both on the provider side and the consumer side. So adoption and engagement, both by the provider and by the consumer, is going to be a big wild card where this goes to, right? And I'll frame across all of that is reimbursement, right? So you can call it regulation, but the way you're reimbursed tends to drive behaviors and how people adopt or take on new models of care, new models that inject technology, right? Injecting a technology that may be great for the provider and great for the consumer that nobody will reimburse is going to be dead on arrival, right? Unfortunately. So you have to figure out that framing of that. So reimbursement is important in terms of the flexibility of that model. The other side around adoption, I'll put consumer and myself in the middle of that, right? As consumers, we need to be the CEO of our own health. And that's not happening in this country, right? It's seen as a God-given right that you get this care and you can use as much of it, and whatever it is, and you should be able to have access to it. There's a certain amount of accountability, responsibility, and liability to how you want to live your life and your health that has to be correlated to that, or you won't change, right? I'm not going to stop eating a dozen Krispy Kremes every morning if I don't have some accountability or liability into what it does to my health and the cost of my care to keep me healthy, or to take care of all the diabetes and everything else I might get from doing that. If I want to do that, that's my freedom to do it. But if I don't have the accountability and from a financial cost standpoint to cover what I'm doing to my health, then that limits how my behavioral change is going to be and how I'm going to engage in that healthcare ecosystem in a different way. So, and that's it. I'm not going to get wearabled up and get little implants and do all these things that guide me what my compliance should be if I really don't want to be compliant. So we got to figure out how that happens in terms of accountability, both between caregivers, between the payers that are financing the insurance, and the consumer that is a part of that has just as much responsibility engaging in their own health and how they're going to manage that. Just like I manage, shopping online for retail or car insurance or anything else, it has to get to that point as well. So, and then like I said, the bottom of that is technology. And I think we got to solving all those things. The tech will be way ahead of it in all stages, is my opinion.
Absolutely. No, that's such a great call out and such good reminders of everything that goes into the healthcare system. And really truly understanding those complexities, and technology, like you said, is one piece that can enable so much. But at the end of the day, it's our jobs as consumers. And then, of course, the regulatory environment as well plays a huge role in what we're able to do. So, Tim, thank you so much for joining us here today. This has been such a fascinating conversation. I'm so grateful we had the chance to connect. I learned a lot, and we'll look forward to seeing you in October.
Me as well. Looking forward to October in Chicago.
Awesome.